Well, good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have had 446,601 cases, 2,735 people in the hospital, and sadly, 5,881 who have died. I would make particular mention today of my friend, Mamie Bryant of Gastonia, a kind and wonderful soul who passed away Friday while battling COVID-19. Our thoughts are with her loved ones and all of those who've lost friends or family members. With the holiday season coming upon us, this is a tough time for people worrying about a sick loved one, and especially those who are grieving the loss of someone close. Our prayers are with all of you. There's real hope that we can stop those painful losses. Vaccinations are underway in North Carolina. The first COVID-19 vaccine shipment arrived at 7:20 a.m. yesterday morning at Wake Forest Baptist Hospital. I even talked to North Carolina UPS driver Danny Parson, who made that delivery, which was the first in the country. In addition to the 3 yesterday, 8 more hospitals received shipments today and began vaccinating. 42 hospitals will receive shipments on Thursday. Our North Carolina team spent months preparing for this moment, and now we're moving our vaccination plan into action. Because supply of the vaccine is very limited right now, healthcare workers caring for COVID-19 patients, along with the staff and residents of long-term care facilities, are up first. We look forward to more. If the Moderna vaccine is authorized by an independent committee of the FDA on Thursday, we expect to get 175,000 doses of that vaccine next week. Just over half of those will go to long-term care facilities. We expect them to be getting vaccinated at the end of the month. Beyond that, questions remain. North Carolina and every other state still need clarity from the federal government as to how many doses of the Pfizer vaccine we will receive going forward. We've been told that each Friday we'll get information about the following week's shipment, giving the states just a few hours to direct where those shipments will go. Yesterday I raised this issue with Vice President Mike Pence on a call with other governors. I asked for more time to plan, which is critical as our vaccines roll out across the state, and they said that they'll work on it. Right now, I'd like to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to provide an update for us. Dr. Cohen.
Thank you, Governor. I'll start with the good news. As the governor said, the first doses of vaccine have arrived and have been administered in North Carolina. It was a historic and emotional day for many as we finally have a new tool to protect people from this virus. Yesterday, 3 hospitals, Atrium, Duke, and Wake Forest Baptist, began vaccinating their healthcare workers. As a reminder, more than 40,000 people participated in Pfizer's clinical trials. The data showed that the vaccine is nearly 95% effective in preventing COVID-19. And remember, you can't get COVID-19 from the vaccine itself. The vaccine imitates the infection so that our body thinks a germ like the virus is attacking. This creates the antibody defense we need to fight off COVID if and when the real germ attacks. We will continue to have very limited vaccine supplies at first. The best way to fight COVID-19 is to start first with the vaccinations for those at highest risk, reaching more people as the vaccine supply increases. That's why we're starting first with our healthcare workers at highest risk of exposure and our long-term care staff and residents. An effort of this scale, we know, is certainly going to have its bumps. However, the more information we have, the better everyone can plan. As the governor mentioned, we still do not know how much Pfizer vaccine North Carolina is going to receive next week. We've been informed by our federal partners that these quantities will be shared on Friday prior to their shipping on Monday. but I hope the federal government will reconsider that timeline. It's not enough time to allow the state and providers to plan for appropriate allocations or to coordinate vaccine schedules for staff. And while yesterday was a pivotal day, we have so much work to do right now to protect each other and slow the spread of this deadly virus. We are experiencing a staggering increase in our pandemic trends, and I am particularly worried about our hospital capacity. Just 1 month ago, we had 1,395 people in the hospital with COVID-19. Today, we have 2,735 people in the hospital right now. That's twice as many people hospitalized than we had on November 15th. 1 month ago, we had 350 people in the intensive care unit with COVID-19. Today, we have 643 people in the ICU. I know we're all getting so numb to these numbers, so I'm asking you to take a moment to think about who these people are. They're our neighbors, our friends, our family members. They're people we love. Too many North Carolinians are getting seriously ill, and with more than 5,800 deaths, too many are dying. I know no one wants this for our state. Together, we can protect North Carolinians from this pandemic and make sure that our hospitals are able to take care of everyone, whether it's for a broken arm or a heart attack or COVID-19. Keep wearing a mask when you're with anyone who doesn't live with you. Keep waiting 6 feet apart. Keep washing your hands often. These small actions can have big impact, and they save lives. As we head into the holidays, we have a hard ask for everyone in North Carolina. The CDC is recommending that people do not travel and instead stay home this holiday season. If you absolutely must travel or gather with others, it's essential you get tested ahead of time, wear a mask all the time, and keep it small and keep it outdoors. Over the next 2 weeks, we are sponsoring more than 300 free community testing events, including a new partnership with AgriSupply, Carly C., Home Depot, Piggly Wiggly, and Wegmans stores in 7 counties. So go to ncdhhs.gov/testing place to find a free testing event near you. Let's keep protecting one another. Whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen, and thanks to you and our team for working hard to prepare for this moment. But the numbers you've laid out are too high, and the vaccine can't yet have a significant effect. We must get these trends turned around. Seeing vaccinations underway gives us hope at the end of a hard year. But this virus continues to be extremely contagious and deadly. We need to persevere and keep using our tried and true safety precautions. Follow the modified stay-at-home order. Care for your neighbors and loved ones by wearing a mask. Keep distance between you and others. The more careful we are now, the more lives we will save. Last week, Dr. Cohen, our Department of Public Safety Secretary Eric Hooks, and I sent a letter to local government officials. We're urging them to help us with enforcement of executive orders to help slow the spread of the virus. Local governments can enforce safety protocols with civil penalties, including fines for violations, instead of criminal charges, which we believe can be more effective. An advisory opinion from the Attorney General's office answers the legal questions. And what we need now is their determination to keep communities safe. Our aim is not to get people in trouble. It's to get people to do the right things to slow the spread of this virus and to keep it from overwhelming our hospital systems. I'm grateful to the many local governments already taking action to keep their communities safe. With the holidays here, I know that it's hard to imagine missing out on our beloved traditions with family and friends getting together. But just like Thanksgiving, we need to rethink what it means to celebrate this December. We're just seeing the Thanksgiving COVID-19 spike over the last few days, and the Christmas holidays could be even worse. The safest option is to connect online or by phone And if you have to gather in person, try to get tested first, do it outdoors, limit the number of people, and wear a mask. COVID-19 tests are available before the holidays. As Dr. Cohen mentioned, we've worked in partnership with retailers to provide no-cost tests at familiar sites in Buncombe, Durham, Iredell, Lee, Mecklenburg, Wake counties, in addition to existing testing events across the state. And again, you can go to that ncdhhs.gov/testing place website to find out where you can get a test. And remember, a negative test doesn't give you a free pass. It just makes it safer. You'll still need to wear a mask, stay outdoors, practice social distancing in case you contracted the virus after you got tested. These are simple measures that work. Doing them ensures that more of our loved ones will be with us for the next holiday season. With an end in sight, let's come together and work hard these next few months to keep ourselves and our families safe. I know we can do this. Right now, I'd like to recognize Emergency Management Director Mike Sprayberry, who's going to give us a brief update on some winter weather that we're expecting. Mike?
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 281 of the State Emergency Operations Center's COVID-19 response. We also have winter weather moving into parts of our state overnight and tomorrow morning, and it's important that everyone is aware and prepared. 3 of our western counties, Ashe, Allegheny, and Watauga, are under a winter storm warning and could receive 1 to 3 inches of snow mixed in with some sleet or ice and some wind. A winter weather advisory begins tonight at midnight and continues Wednesday for the rest of western North Carolina, our northern Piedmont, and the Triad area. Hazardous road conditions and some power outages are likely in all of these regions through Thursday morning. Everyone should follow their local forecast closely and stay alert to changing weather conditions over the next 48 hours. While this is currently forecast to be a minor winter weather event for our state, winter weather in North Carolina is notoriously difficult to forecast, and just a small change in the forecast can mean big changes in storm impacts. DOT crews are currently brining highways across central and western parts of the state. If roads do become hazardous, remember to decrease your speed and increase your following distance. The best advice is to stay off hazardous roads unless you absolutely must travel. Staying aware and being cautious over the next 48 hours will help us all stay safe during this winter weather. And while you're preparing yourself for this winter weather, like the governor and the secretary said, don't forget to observe the 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, sir.
As always, thank you, Mike. Also with me today is our Secretary of Public Safety, Eric Hooks, and Commissioner of Prisons, Todd Ishii. Our sign language interpreters are Brian Tipton and Monica McGee. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll take questions from the media, and if you could give your name and the organization you represent, we would appreciate it. We'll take the first one.
Our first question is from Marissa Tansino, WFMY.
Hi, Governor. Hi, Dr. Cohen. This is Marissa Tansino with WFMY in Greensboro. Thanks for taking our questions today. First, I wanted to ask about hospital capacity. Of course, that is a huge concern. So what conversations are you guys having with regional healthcare providers regarding where they're at? What contingency plans do you have in place? And at what point will additional facilities be needed to be opened for more hospital space?
Well, we are working closely with hospital CEOs across the state to make sure that they're capacity is always there, that they have hospital beds, that they have ICU beds, and that they have ventilators. And really, they have been doing an excellent job. They went through this this past early in the summer, and so we learned a lot about what to do and not to do. And so, I feel good about where we are with them and their capacity. We just need to help them out. We need to wear our masks and wait 6 feet apart and wash our hands and be responsible and do the things that we need to do so that they will not get overwhelmed. And I know that Dr. Cohen has been talking with them not only about vaccine distribution, but about their surging and making sure they have enough beds and staff. So I'll let her address that as well.
Thanks, Marissa, for that question. So our teams are coordinating with the hospitals daily, sometimes hourly, to understand what's happening and if folks need additional support. And I want to echo what the governor said. I think the teamwork across hospitals that I have seen is really unprecedented, and I'm really proud of how North Carolina is approaching this, because it is a team effort. So if one hospital starts to get stretched, can another hospital help out? So I think that's been incredibly important to have that visibility and the sharing of information. So our teams meet nearly daily with various parts of the state. If we see any unusual increases in numbers, we're immediately on the phone with folks, coordinating, making sure that we know if they have support. As far as your second question related to, do we need to open up new space? What I would say is hospitals are already working within their space to open up additional COVID-related space. We know that they've been doing that over the last number of weeks. They had certain COVID units. Those units have become full. Now they are converting other units to now become COVID units as well. It does mean that there is less capacity for other kinds of things as we try to staff up more on COVID. What I'd say about opening, whether it was another location or there was talk very early on about field hospitals, for us in North Carolina, it's not a physical space, but rather a limitation on the people, the doctors, the nurses in particular, that are needed and that are really strained here. We have physical space, but what we need to really manage very carefully are the people and the staffing. And as we know, all places around the country are seeing similar strain. So this is not an ability for us to go and call a partner in another state and for them to be able to send people or staff resources to our state. So we know we have to manage this internally, which means we have to watch very carefully what's going on, and we're going to have to adjust, which means doctors and nurses that might work in a different part of the hospital or in a different kinds of patient populations may now have to do different kinds of work, taking care of inpatient COVID folks or doing work in the emergency room or urgent care setting. So hospitals, like I said, are doing a terrific job of right now managing that internally. And I'll just echo once again what the governor reiterated. We all have a role to play in helping our hospitals be there for everyone. And that's not just for COVID. We want them to be there if you have a heart attack, if God forbid you get hit by a car. We want your hospital bed, and importantly, the doctors and nurses to be there for you. That's why we all have to work really hard right now to slow the spread of this virus, particularly as we move into the holidays. Thanks.
Next question, please.
Follow-up, Marissa Tansino, WFMY.
Thank you, Governor and Dr. Cohen, for that answer. I also wanted to ask about vaccines. I know that you mentioned that you're still waiting for word on how many will come next, when the next shipment will come. But as we start to see these first healthcare workers get their first dose, how is that going to work in terms of communication between these regional healthcare providers and the state in terms of how many second doses they need? What will that process look like?
Obviously, this is logistically complex, and it's why this team has spent months and months getting ready for this vaccine distribution. They've created a database where it would record how many people have gotten the first dose so that we would know who needs the second dose. And you got to remember that with Pfizer, it's 21 days. And with Moderna, it's 28 days, and that people need to have the same vaccine for their first and second dose. They can't have one from one company and one from the other. So it's going to be a real working together with our healthcare providers, making sure that there is a lot of communication. And as we get more and more vaccine and spread it out further across the state, it will get more complex because there are more people who are going to be involved in it. But I know that Dr. Cohen and the team there have been working on this really on an hourly basis here. They've set up a war room where they are taking questions from healthcare providers and providing answers, as you can imagine, as the trucks roll in and put the vaccine out. There are some questions by providers, and we're trying to communicate and making sure that they know exactly what to do and that we don't waste a single dose. Dr. Cohen, would you want to supplement that?
Thanks, Mercer. One thing just to add, so what we are getting right now are all first doses from the Pfizer manufacturing company. So they are all being given out to healthcare workers, and they're all first doses. So what will happen is 2 weeks from now, the same places will get the same exact number of doses in 2 weeks, so that in that third week, they can then administer that second dose 21 days later to those same folks. So if they got 1,000 vaccine doses this week, in 2 weeks they'll get 1,000 doses of Pfizer as well to be administered for the following week. So the federal government is holding back the second dose, and in 2 weeks we'll be sending those. So as the governor said, this is going to get complex because we'll be sending out first doses and second doses as soon as a couple weeks from now. Thank you.